Good morning, good afternoon, good evening, depending on where you are joining us from. I am excited to bring you another wonderful episode of The Adventures. I am Kunle Olufemi, your host. As you know, on Adventures, we seek to bring you the stories of vision and courage behind the brands and the organizations that you see around you every day. By sharing their stories, we aim to help our audience avoid some of the pitfalls that they experienced and, of course, consequently, achieve stability and growth faster than those organizations. It's my pleasure to introduce to some and, of course, tell a little bit about our guest today, who is, very special, right? Our guest today is Mrs. Niniola Williams. She loves to be called Niniola, and she's a prominent Nigerian public health leader whose work focuses on infection prevention, epidemic preparedness, and strengthening health systems. As the managing director of DRASA Health Trust, she oversees programs that train frontline health workers, build community level disease prevention capacity, and improve Nigeria's readiness for outbreaks. Her role as a faculty at the University of Lagos of College of Medicine, Center for Infection Disease Control and Patient Safety further positions her at the center of national efforts to professionalize infection control training and equip health workers with essential skills. Her career also indicates impactful work with management sciences for health, contributing to major public health programs addressing HIV/AIDS, tuberculosis, malaria, microbial resistance. Williams' leadership has earned international recognition, including a feature by the Skull Foundation and an award in the GDA 2022 Digital Skills Competition. Thanks once again for coming on the adventures, Niniola. Great pleasure to have you around.
Thank you for having me. It's good to be here.
All right. Yeah, and please, I apologize for probably just not pronouncing some of some of those titles and some of those, um, jargons within the scientific space correctly. But it's really an honor to have you here, and I want to start by asking you to, tell our audience, right, our viewers, a little bit about what you do, right? Possibly, if you can double click into some of the, the scale of what you do and the impact you're making, I think that will be very helpful.
Okay,
All right.
great. Thank you.
Thanks a lot. Yeah.
And thank you for this opportunity. So, I have been leading the Dr. Ameyo Stella Adadevoh, or DRASA, as we like to call it, Health Trust,
Mm,
public health organization for 10 years. And what we do is essentially developing people into what we call health champions, ensuring that we have a network of these champions across the country who can drive change and improve the healthcare system, while also working with federal, states, and local government authorities to shape policy and institutionalize disease prevention. Everything we do is about people keeping people healthy and safe and keeping them away from the hospitals. But if they do have to seek care, our role is to ensure that they get quality care. And so that's really, at a high level, what we do. What that looks like on a day to day has varied over the last decade, but I can give some examples. So far we've been able to equip 96,000 health champions, over 90 health champions across 32 states in Nigeria. We have trained and certified 15,000 healthcare workers. We have also worked with the government to review and develop 28 national and subnational policies and guidelines. So, again, our work is sort of grassroots community participation and also government partnership and policy. So, looking at things from two ends, from the top down and the bottom up. And so, in a very practical sense, what does this look like? For example, right now, we're working with state governments to strengthen what we call infection prevention and control, which is really just to say that we're putting in an accountability system so that health facilities in the states that we're currently working in have a way of ensuring that when patients come for care, they don't um, contract any infections while in the hospital. Hospitals are places where there are sick people, so there are lots of germs and things spreading. And so we all know stories of people who went in for one thing. While they're there, they develop something else. They end up on admission for 2 weeks. Their bill is much higher than expected. And there's this ripple effect of what that means for that individual, their personal outcomes, and their family. So ensuring that there's safe quality care, health workers are protected, patients are protected, and putting in systems and accountability, tying it into things like the licensing of the hospitals, making sure that they're reporting data and they have key indicators that are being tracked for that is one of the things that we're doing now. So really working at the systems level to make sure that policies are not just pieces of paper on a shelf, but they're being embedded into the everyday work lived experience of patients and health workers. And then on the community side, we are very, very passionate about turning everyday people into disease detectives. So we have another program that we're running in several states that ch- identifies leaders in communities. These can be youth, artisans, traditional leaders. We identify gatekeepers and regular everyday people, market women, and so on and so forth. And we train them and equip them to become part of the public health system. Because ultimately, when issues happen in communities, by the time the government hears about it, it's usually a bit late. Meanwhile, the people in the community are the ones that know immediately when there's a problem with their neighbor or the person down the or somebody in their school, and so on and so forth. So turning those people into disease detectives where they can very quickly see that this baby looks like he has measles and the mother doesn't know. Or this child is stooling profusely. Could it be cholera? Where did the child go and drink water? Identifying issues within the community in a way that is fast enough to get people quick care and reduce, negative outcomes like prolonged hospitalization or even death in many cases. And so making sure that those grassroots influencers and people who are doing their everyday work, you're a butcher in the market, but your role is to make sure that the meat that you and your colleagues are selling is not infected for people to come and buy it. Basic little things that prevent disease and help people to stay healthy and live healthy lives. Is what we do. And then connecting those people to the system so that when there is an issue, they know exactly who to call, who are the local health authorities, who can quickly come and respond and assist. So those are some examples of the kind of work that we're doing now.
And I think it's phenomenal. I think it's phenomenal. Well done, and thanks a lot for, sharing all of that. So, is it okay, Niniola, to assume that the disease detectives are the 96K people that you alluded to earlier?
Yep, exactly. So that 96K is comprised of health workers, youth, and community members. Those three categories of
Okay.
people who, over time, we have engaged, equipped, trained, and refined, and brought them into a network where they are working. And when I say working, I don't mean it's a job. It's become
Yeah.
part of their role in their community or in their circles of influence, whether it's in their schools. We've been working in secondary schools since 2017. And the curriculum we've been using there, we're now working with federal authorities to see how we can scale it into the secondary school curriculum nationwide. Because we've seen what these young people can do. They do amazing things and they do more than what government can do alone. Our philosophy is that if we want to change Nigeria, we cannot sit down and wait for government to do it. We have to go and help them. We have to be parts of the solution ourselves. We have to have everyday people stepping up, just like Dr. Adadevoh did, to change the course of history for the rest of us.
Hmm. Thanks a lot. And I mean, that dovetailed nicely into my next question for you. Speaking of Dr. Ada, it looks like, you know her on a very personal level, right? And, just hearing you talk, I can kind of deduce that this is like a love project or passion project for you. It's not commerce, right? This is something very close to your heart. Can you go a little bit into how it is all started? The history. What were the events leading to this? Over to you.
Yeah, so Dr. Ameyo Stella Adadevoh was my aunt. She was my mother's senior sister. the firstborn in
Oh.
their family. And so, like you said, this is not a story. This is not something I read about. This is, what happened to her colleagues is something we all lived through as a family. And after losing her, it took about a year for us to decide exactly what we wanted to do, but we knew that we didn't want to just leave it. She and her colleagues did some extraordinary things. She was not an infectious disease physician. She was an endocrinologist. Nope. Her specialty was, in fact, diabetes. She was an endocrinologist, though. And so she was in a private practice. She had been there for 21 years. And she just went to work one day. She just happened to come across a man who, of course, we now know was later confirmed to have Ebola. And her suspicion was correct. Despite all the pressures that she faced, she stood her ground and she refused to let him leave to attend the conference he was going to. She refused to discharge him, despite all the threats she got from that they're going to arrest her, she's kidnapping him, because she didn't have a confirmed diagnosis. She just had a gut feeling and she just knew that this man cannot leave. And that single decision that she made changed history for Nigeria and many other countries, because he was going for an ECOWAS event. So he would have infected diplomats from, West Africa region. And so looking back at it, it was a very painful time for us when she got sick and eventually passed on. And we just knew that we couldn't let it go like that. What she did was um, an example of the person she was. When we talked about it as a family, I'm not sure I could have done what she did. Many of us would have run away, knowing the risk, knowing what could come. But she was always that person who put others first and lived a very service oriented life. And so, based on that, we had to do something to continue that legacy. And that's how a year later, the DRASA Health Trust organization was born. At the time, I was already working in public health, working for MSH, as you said, working, on different projects in different countries. And it was time for me to come home and focus on building this organization into an institution that could, help disease prevention across the country. So that's what we've been doing
Mm.
for the last 10 years.
Wow. Wow. Thank you. Thanks so much for sharing that. So you've basically dedicated your life to the prevention of, diseases in, should I say Nigeria or sub-Saharan Africa,
Yeah.
or
Yeah.
what are you looking at? Nigeria
No,
or
our
beyond?
scope is beyond Nigeria. We've been working in Nigeria alone, but of course we know that whatever happens in Nigeria affects the whole world. So Nigerians travel, diseases travel, and again, we're focused on, yes, the big ones: Ebola, Lassa, all those ones that make headline news, monkeypox or mpox as it's called now. But we're also focused on the everyday infections that cause people to miss work, miss school, end up spending so much on medications and treatments. Many of us, even now, we've experienced this new malaria that is resistant. You take malaria meds, it's not going, you have to take another course, or you take antibiotics, it doesn't work, they give you another one. All of these little things that are happening to people around the country on a day to day basis, whether it makes headline news or not, that's what we're trying to prevent.
Hmm. Thanks a lot. Thanks a lot. My next question for you, and I'm very conscious of the fact that we don't have a lot of time, so I'm trying to make the most of my 60 minutes.
Sure.
My next question for you, Ninola, is around. So I know this is not commerce, or this is not, there is no, um, if there is a minimal, commercial motivation in this is, like I said earlier, a passion project for you. But at times also, you know, I know that as humans, we want to give our heart and our time and our attention to something that makes a real difference, right? And not just something whimsical or something along, and I'm wondering how when you started out, right? How were you able to kind of put some quantification to, to what you're about to get into, right? I know you're already in that space. You probably have some data. It would just be good for you to, shed some light on, how you figured out the real need, right, for infection prevention training, right? And of course, confirm that, Dr. Adat's, approach, would actually make a difference in the lives of people.
Yeah, so I think for us, again, like I said earlier, it took us about a year to decide what exactly we wanted to do. And that wasn't because we didn't have ideas, it's because we wanted to make sure that whatever we put our efforts towards would yield the greatest results.
Yeah.
We wanted to be
Yeah.
sure that we were actually solving a problem and not just creating another
Mm.
NGO, that exists to do what and what.
And we have a lot of
Many
them.
sometimes, I think. So yeah, so we really took our time. We did a lot of market research. We partnered with a consulting firm, and we used data, because ultimately it comes down to evidence. You can't think you know anything. You have to let the data guide you and show you what the reality is. We were not experts at the time on disease prevention in Nigeria. We had lived through a tragic experience, and we wanted to turn that into something positive. And so really it took time for us to research and figure it out. But ultimately, it stemmed from the fact that this infection prevention and control training that healthcare workers don't have much of in Nigeria and across the world was what could have possibly saved my aunt and her team. They did what they could with what they had, but what we discovered is that there was no formalized, robust, or comprehensive education in that for medical students, nursing students, midwifery. So you graduate, you get sent to a hospital, you go in there knowing that the hospital is full of germs and all kinds of things, but you don't have that specialized training on what it takes to protect yourself, protect your patients, and keep the environment safe. And so that was where we now saw a gap. And we said, okay, what can we do? So we entered facilities and we started working with them. We started working with the University of Lagos and other partners to develop curricula, courses, diplomas that healthcare workers can now become officially, properly trained and certified in this field. That we realized was not enough, because that works when people end up in the hospital. Now they can get safe care from these trained health workers. But what about people who stay in the communities? We know that many Nigerians don't seek care when they're sick. We resort to traditional herbal medicine, other things, maybe local chemists, and drug sellers in our communities. And so we had to go into the communities as well. We used the youth as an initial bridge through the schools, and then we entered the communities themselves. And like I said, we've been working with many community influencers and community members across different LGAs in the country to equip them to also be guardians of health and also be disease detectives, so that when something does go wrong, it doesn't spread fast and it can be quickly treated.
That's very helpful. Thanks a lot for sharing that, Niniola. So, just thinking through some of the things that we've discussed, it looks to me like so. And correct me if I'm wrong. It looks to me like there are three major interventions, right? That I think I can understand from what you shared. So, number one is the training of health workers who work within hospitals and educating them on how to manage some of these things or handle, you know, this kind of things. And number two is, like what you do with the community, right? The 96,000 people, right? And then the third intervention is more like on the policy formulation and curriculum development kind of thing, right? Will that be a good summary of, your like a three-prong approach to disease prevention?
Yeah, absolutely. Those are the core places where we work: government, communities, and health
Mm.
facilities. That's where you'll find us. Because again, we've seen that is where systems need to change. That's where things really, if we can get it right in those three locations, then comprehensively we now start to see a difference.
Very clear. Now, a follow-up question on that, would be that if you look at these three interventions,
Mm.
right, which would you say is making the most impact today, right, and really delivering on the promise of disease prevention and all of that, and that you probably need to scale up?
It's hard to pick, and I'll tell you why. Because again, in our
Mm.
experience over doing this for 10 years, we've realized that none of them can work in isolation. Policies have to be there. The government piece has to be there, because that is what sets the tone, sets the standards, make sure there's accountability, which is a very important thing in healthcare. If nobody is accountable, nothing will ever work, right? So that has to be there. But you can't have policies and accountability only in health facilities, hospitals, and clinics, because of the community element, which is where everything starts. People fall sick in their homes. And what we want is for every Nigerian to be able to access and trust their local health facility enough to go and seek quality care rather than staying at home like we see often, hiding or treating, self medicating, and complicating the matter up until when it's almost an emergency and then seeking professional care. And so for us, those three things, we can't separate them. It's hard to say which is the most effective. They're all effective. For example, in our health worker training programs, we've seen that the average change in knowledge score jumps from about 46% to 85% after they go through our programs. So you can see that that alone is a huge, difference because we're equipping them and building competencies that they've never had before. For the average person in the community, it's the same thing because we're teaching them and equipping them to play a role that they've never done before. And the policies are also extremely important and effective, like I said, because that creates the system and the enabling environment for all of these things to work. And so it's hard for me to pick one, to be honest. And I will say that before this stage of DRASA, before we got to this 10-year mark, we were doing a lot of other things. But we've streamlined to just these three because these are the most important and most crucial things that we believe investing in and scaling up will change, on a national level and even internationally.
All right, so I agree. It's
It's
a
hard.
it will be difficult. Yeah, it's hard. I totally get it, and thanks for being, like on point on that, right? Because some other guys will try to say maybe this, maybe that, but you're like, no, it's
Yeah.
difficult, and I appreciate that. Um, Now, my next question, if you don't mind me going off script a
Sure.
little bit, right? Don't worry, I'm not going to put you on the
It's
spot.
fine.
My next question is around, so you mentioned something around, you're trying to build a community of people that have trust in the primary health systems available within their, respective localities. And and I couldn't help wondering, is that trust already earned? Is it that we have things or system or infrastructure, right, within the local space that they are not aware of that they can leverage, right? Because the last time I checked, the local primary health centers and the local public health systems within the local government are not always very
Yeah.
good,
Yeah.
right? So if we're telling people to trust that, is that trust earned? That's my first question. Now, my follow up question on that will be around, uh, you know, something I look at you and your passion is, infectious, right? Allow my allow my play
Yes.
on words,
Yes.
right? Your passion is yes, it's infectious, is gets across and all that. And I'm wondering if that is a factor in being able to recruit these community players, 96,000 people and growing, right? Who have now become like a part of your army, so
Yeah.
to say, fighting diseases. How are you able to do that? Is it your passion? Is this, I'll be, I'll be delighted to hear how you go
Yeah.
about those
Yeah.
things. I hope those questions are
Sure, yeah,
clear.
absolutely. So the first one, you're right. There are huge challenges when it comes to primary healthcare in Nigeria. What we are lucky right now, our current minister was the former leader of the National Primary Healthcare Development Agency. He's passionate about primary healthcare and he understands why we have to get it right. We have seen it work very well in Nigeria's history if we go back in time to the days of Rapsam Kuti. But now it is broken, if we're being quite honest, and it's not functional. So when I say building trust in the system, it's also setting expectations and letting people understand that yes, there are challenges. Yes, your local health facility may not be the most robust in terms of what they can offer you, but plugging into the system is step one of you protecting yourself and your family members, your household, your neighbors, so on and so forth, from what could end up being, a tragedy. And so getting them to understand that these health workers are suffering as much as you. They want to work in a facility that has all the equipment and gadgets and all that. We are all dealing with what we have on ground and trying to make the most of it. And so getting them to see their roles as these health champions, as we call them, see their roles as encouraging neighbors to seek help is really, we've seen it work. We've seen this. I mean, I can give many stories. There's a story of a lady who is a hairdresser in a local government in Lagos State, and she noticed that one of her neighbors was coughing. She suspected tuberculosis because of the training she had gotten through us. She confronted him and he immediately said, no, typical reaction, God forbid, I'm fine, this and that, I'm going to drink this thing, there's no problem, all of that. Long story short, she kept insisting. And she eventually got him to speak to the local health authorities on the phone, not going anywhere, just on the phone. And after having conversations and all of that, they built a relationship and trust. And he himself went to the local health facility, got diagnosed, and indeed he did have tuberculosis. So think about if that man had continued walking around in his community, talking, engaging, going to work, coming home, the impact and the spread, because this was an urban slum community at the time, what would that have ended up? How many other people would have been affected because of his lack of trust in the system? So when I say building trust, this is a kind of example of what I'm talking about. It's not perfect, but we're trying to start the process while relying, of course, on the government to fix some of the more infrastructural and issues that are bigger than what DRASA can do. And then your second question around how my passion, infectious passion, as you called it, has helped us to achieve what we've done, especially with the network of 96,000. It's not me. I have to say, it's really not. I have and I've always had, as the leader of this organization, an amazing team behind me. People have come, people have gone, but I have an amazing team of people who are all equally passionate, and I wish you could meet some of them as well. And together, we're the ones that have done, this work. We work very, very closely with the government, which was hard because in the beginning, as a family, we were not happy with the government and with the way things happened during Ebola. But we soon realized that we have to overcome the tragedy and the pain and use government as the number one strategic partner we have as for this organization to get things done. And that has helped immensely. Working through government structures, because I can't go to a community in Sokoto and tell you who the local influencer is. I don't know. So we work with people who are on the ground, including government officials and authorities, to help us achieve the goals that we have, including recruitment, training of these health champions across the country.
Thank you so much for all that you've shared. I think it's really very helpful to see the angle you are coming from on the matter of trust for the system, right? So you are not making promises that are unfounded, right? You're essentially, we're honing it. We're saying that we know our system. We know it's not, but in spite of that, you can still get two done, one, two, three things
Exactly.
done. And, I'm sure they probably gave it a try and found it to be true. And then, so that's a very helpful perspective because I know how, the system
Yeah.
can be. Let me pivot, and thanks for the second question too. It's good to know that it's not it's not a one woman show, right? Now, I'm a big believer in the power of leadership, right? As one of my friends here will say, a fish rots from the head,
Mm,
right?
mm.
So
Yep.
yeah. So whatever your team are getting done, right? They probably got stung by you first, right? They got infected by you in quote, and then So again, thanks for all you do and for kind of replicating or multiplying yourself in them, and then they are now being able to take it forward. I think it's a great thing. So well done. Um, if you don't mind me, I want to pivot the conversation a little bit into uh, issues a little bit around finances and both on the personal and um, corporate level, so to say, right? So I will ask it in just two questions so that you can just take them at a go. So number one was you were gainfully employed. Correct me if I'm wrong. Before you,
Gainfully employed. Yes.
I assume you know, and what you do today is not for profit. Yes, you're passionate and all of that. Were there concerns around you making you're smiling already? You probably get this question from time to time, right? Were there concerns around you making that transition to this kind of work because it may not be as lucrative as perhaps what you were involved with and what you were doing then? So that is question number one. Question number two is a little bit more at a speaking from a funding organization, standpoint, especially for not for profit kind of work where you're not necessarily selling things and making revenue and bottom line, top line kind of thing. It's a social impact kind of thing. Now, any work, be it for profit or not for profit, that we want to, are always, finances are always a thing, and I've heard it from 1,001 people. Finances are always a thing, and I would like to understand how you navigated it, you are navigating it, or you intend to continue to navigate it in the future. Now the acclaim is there. Maybe you're very popular now, people know your work. But in the initial days when you didn't have all of that acclaim and all of that reputation and all that, how did you manage that? And what would be your advice for other people? I hope that is
Yeah,
clear
yeah, no,
enough.
that's clear. So let me start with the personal one first. I think leaving my former job to come and do this, for me, it was an easy thing to do. It didn't take time. I didn't have to overthink it because I knew that I wanted this thing that we were creating to succeed. I felt I had learned a lot from the previous organization where I was, and that I could apply those lessons and my experience in my career up to that point generally to lead, at least to try. My goal was let me try my best and see if this thing is going to take off or not. But it was a huge shift emotionally, financially, professionally. But I think a couple of things made it easier, which is first, the fact that I had clarity. I knew what my purpose was, I knew what I was doing. For me, my faith is what drives everything. And it was a prayer point, and it was very clear that this is what I was supposed to be doing. And so, again, the personal connection, because I was doing it in memory of my aunt, who I was very close to, somebody that I loved dearly. It was very personal. So giving up the incentives of the life I was living before, I had my own place, I had my car, I was earning well, I was traveling up and down. Being able to walk away from all of that to start from, I can't even mention what my initial salary was, but let's just say to start from the beginning. Um, I wasn't concerned about that. I knew that everything was going to somehow work out because I really believed that that was what I was supposed to be doing at that point in my life. And I had an amazing support system, I can't lie, my family. But beyond family, having a board of trustees, a board of advisors, people who believed in the mission, believed in the cause, and so many partners, operational partners. People came and said, oh, we'll help you with legal, we'll help you with accounting. Having that structure when we first started really made things easy for me to be able to put everything towards this and do my best to make it succeed. And of course, family support was also essential. It's leading this kind of organization, or rather transitioning from where I was to where I started from with DRASA, wouldn't have been possible without that entire support network that I've just described. It's not something anybody can do alone. And so, from the financial point of view, yes, it was a change for me, but I knew that things would improve with time. And I knew that I had to do it at that point in time. There was no doubt in my mind that I was making a mistake. I never questioned it. I knew it was what I was supposed to be doing. In terms of the organization itself, again, when we started, we had very, very limited resources. It was hard because we didn't have a track record. We didn't have results to say, we can increase people's knowledge, we can reduce the burden of disease. We didn't have the impact or the results to show because there was no work that we had done. We were starting from scratch. And so it was tough. Also, people felt that Ebola has gone. What are you still talking about? And we had to get them to understand this is not about Ebola or any big, epidemic, pandemic type of disease. It's about the everyday issues that we face in Nigeria. And so dealing with the mindsets of people that we needed to engage, donors and partners, and also just the fact that we were new and we had no results. It was hard. But one of the things that, and thank God for this, it was a huge blessing in a way. When people heard the name, they wanted to help. And so for the first almost 2 years, we were majority funded by individual donations, not corporate, not grants, because we couldn't approach any big corporate because we didn't have a track record. We couldn't apply for grants because we had no, major profile or projects or results to show. And so we spent that first 1.5 to 2 years building our portfolio, doing the work, showing the results, so that we could transition from individual people supporting us because they knew her story and knew what she did, to now the grants, the corporates, the philanthropies, and so on and so forth. And so that has been our story. We still have a good donor base of individuals, some of whom have been supporting us for the entire decade. But we've now transitioned into the future of what it's going to look like, knowing that last year, 2025 in particular, the nonprofit space faced huge changes as regards funding, with traditional aid funding pulling out, philanthropies tightening, their scope as well. And so as part of our 10-year anniversary last year, October, we launched an endowment fund. And that endowment fund is what is going to sustain us for the next decade and beyond, alongside the traditional fundraising that we've been doing. But again, we're thinking of finances differently this time around, looking at the endowment fund as an investment. People give us a one-time donation. It sits in this endowment account and generates income that we can, or rather revenue and returns that we can now use to operate and do the work. So rather than going back to a donor every year and saying, we need more money, just give us a lump sum and we're good. That amount you give us will give us the returns that we need to continue the work. And so that has been our shift from, people putting their hands in their pockets to give us any little amount and adding up to what we could use to prove ourselves in the beginning, to now shifting into trying to be a bit more independent when it comes to our finances.
Wow. Thank you so much for sharing that. All clear, right? Both on the personal front, right? And it's great to really have a support system in place. And I have a follow-up question for you on that, if you don't mind. But before I ask that question, I also want to say thank you for sharing the thought around sustainable, what I termed in my head, sustainable, not-for-profit funding, right? Because, the whole endowment thing, it's a bit new to me. But it's good to really think about it like that, because at some point, donor fatigue sets in, right? People get tired of just doing it and doing it and doing it, right? So this looks like a smart way to approach it, especially, you know, if you're able to get some, significant contributions from, people who can support in that skill. Now, two quick questions as a follow up, if you don't mind. Wow, time is not my friend today. Two quick question. Number one is, so if you look at your donor profiles today, right, in terms of what comes in and all of that, what would you consider to be the mix in terms of what comes in from individuals and what comes in from, say, corporate, right? Just like a simple mix. Number one question. Number two question was around what you mentioned around the support system. Just want to check with you, in your experience, how important would you say having a board of directors or board of advisors from the very onset versus having it a couple of years down the line, right? But having them from the very onset, how important do you think that is, or should be for every new organization that is setting out? I hope those two questions are
Yeah,
clear.
thank you. So regarding the first question, I think you were asking about the mix of funding that we have. It has shifted, and we're less dependent now on individual donors. We still have some who are consistent and some who are not so consistent, but either way, there's still an individual donor base that we have. But the majority of our funding now, I would say upwards of 80% to 90% of it, is coming from philanthropic organizations and institutions. So these are institutions that seek to support charity. Some of them are family foundations, others are foundations set up by businessmen and women who want to have a philanthropic impact in the world. And currently, all of them are non-Nigerian, non-African, to be quite honest. We have transitioned. We've been through philanthropies based in Nigeria and the continent. We've had corporates, both local and international, that have supported us. But at this point in time, it's mostly international philanthropic organizations that are supporting us. And again, that is the case for many nonprofits. The mix and the composition of your donor base shifts per phase of organization, and as you grow, and as the landscape itself shifts. So that's just where we are now. But that's just to say that we're really grateful for everybody that has supported us up until this point, because honestly, none of this would be possible if we didn't have the resources, financial, in kind, and human, to get the work done. So that's that. And then in terms of the board, for me, structure is essential, and I'm grateful that I came from uh, the earlier parts of my career, that this was not the first thing I ever did, because I got to see how things can be done and should be done. I also got to see how things shouldn't be done. So when starting this organization, for me, it was essential that we had that structure in place. Governance is essential and key for many reasons: for accountability, for trust, for building external partnerships. And for strategic direction. And so for us, having a board of directors or trustees first, and also having a board of advisors, was essential from day one. We wanted the board of trustees to be the stewards of the organization, to be involved in more of the operational oversight and all of that, while the board of advisors were all, and the board of trustees are non-health professionals, people from private sector, people who can bring different perspectives that we need for driving the vision forward, versus the board of advisors, who are all not the technical experts in infectious diseases and medicine and nursing and the like. So pharmaceuticals and all of that. So that's, for us, was essential from day one, and I have no regrets about that. I would advise that anybody embarking on this kind of a journey, set up your systems and structures from day one. Um, these things are all crucial, especially to set the tone from the early days. There's nothing wrong with starting, and then if you don't have it, you manage. But if you can put it in place from day one, it will save you a lot of stress, inefficiency, and other issues down the line. So yeah, that's what I would say.
Wow, thanks a lot, Niniola, for sharing that. I have other questions on those matter, but I
Okay.
want to move on for the sake of for the sake of time. Um, you've been doing this for 10
Yeah.
years, right? And as we say locally, that
No,
is
it's
not
not.
beans. That is not beans. It's not beans at all. 10 years, it's a long time to, and you've done this, you've built it up, right? But now maybe these are very exciting times, right? Donor profile on the rise, loyal staff, impact, becoming more apparent. That's what we all want to do. But I'm sure that it has not always been like that. The question I'm trying to get to is when would you, or what would you consider like an inflection point where it really start getting really exciting? Like, yes, yeah, we were making some progress before, but at this point, that gang kind of,
Yeah.
gang, right? um
Yeah.
that gang kind of moment where things just seems to, like, you know started going stratospheric, if I can
Yeah.
use that word. What would that moment, time, or event be like in your
That's a
opinion?
great question. I think there are a few moments like that in our 10-year history, and I'll just quickly highlight a few. I think the first was when we started being seen as a technical partner of government, as a mini institution on our own, rather than a memorial organization. Of course, like I said in the beginning, and still till today, the legacy of my aunt is what drives what we do. But at a point, we had to prove ourselves that we can stand on our own 2 feet, apart from her memory and what she did, that we have value to add, that we um, have something to offer. And so her name and her story definitely opened many doors for us. And like I said, helped us, especially in the first 2 years, build the foundation of what we are today. But we had to also get to a point where people saw the organization for what it is, beyond her. And so when we started seeing that people were calling us for important meetings, and we were being asked to take on certain responsibilities, um, you know, That was exciting. Like I said, we've been working with government from day one. But when the government now came and said, hey, we would like you to lead the development of this 5 year national strategy, that was a turning point for us because now we're in the forefront. We're being seen as a partner that can use all of our experience and expertise to actually drive and guide policy and implementation. And so really that transition for us was a huge turning point. Um, and I think also another one was when we now entered the communities. Like I said, that's really been an important part of the work. We didn't start in communities, we started in health facilities, eventually in schools. But the community element, expanding our portfolio and our reach, and ensuring that from a grassroots level, people are influencing the health system, people are able to be part of the health system. Their voices matter, and we're bringing them to the table to contribute and shape their health system on a local level and beyond that. That was also a very exciting thing for us and continues to be. So I think those are a couple of times when I would say we've had genge moments of wow, okay, this is exciting, and it's helped us to also validate that we are achieving what we set out to achieve.
Very, very, very helpful perspectives. Thanks a lot for sharing those. Right? I mean, I know I can imagine what that feeling would have been like when the government reached out to you to say, can you come lead this, right? Or when all of a sudden the people you're able to get everyday people, right, to become a part of something you're doing, and you can see the changes they are making in the society or in their communities in their own little ways, right, in their own little way. I think that, yeah, I can kind of envisage what that feeling is like, and yeah, I can relate with that. Thanks a lot for sharing those. Now, we have just about 7 minutes, right? So that we can just bring this to a close. And I have like maybe two and a half questions, right? Depending on how this flows. The first is around I am a Nigerian, right? I've lived the better part of my life, right, in Nigeria before I moved abroad. And I know how difficult it can be for ladies to lead things, right? Especially when you're dealing with it's a very patriarchal kind of society. It's evolving. Don't get me wrong. It's evolving. Things are changing, right? But I know how difficult can that can be, and I'm wondering what your experiences have been like, especially partnering with government and government officials on one hand. On the other hand, outside of that, are there other challenges that you've had to deal with, right, including people people challenges, finding talent, retaining talent, and keeping them compensated, especially in the days when you probably don't have a lot of cash
Yeah,
and sitting in the bank, right? A lot of challenges, but let me just leave you to that, and then I'll
yeah,
pick up
yeah.
from the
That's
question.
that's great. Thank you. So let me start with the second one. In terms of challenges, yes. In the early days, it was hard. Um, I've been told I look younger than I am. I'm a female, and so those are just off the surface. Before I open my mouth and say anything, those are
That's not necessarily a
in
bad
this
thing,
when
isn't
you're
it?
trying to get things done. It can be. It depends on who you're trying to
It can
interact
be. I
with
get
and
it.
all
I
that. But at times, it can be detrimental because people are judging you before they even engage with you. Right? They've already made up their minds that this woman wants to come and tell us how to do things here. That kind of approach. And to your point, Nigeria is tough for all of the reasons that you've stated. And so for me, it was again coming back to the reason why I started all of this. I knew that this was my purpose. I knew this is what I was supposed to be doing. And so I knew I wouldn't fail. It was hard. There were a lot of rejections, a lot of no's, a lot of people who were not interested in what we had to say and what I had to say. But for me, it was about not giving up and knowing that there will be one open door. There may be five rejections, five no's, but at least one of them will open, one of them will come through. And I have to say honestly, and maybe this is the God factor, we have found and I don't want to be cliche and use the word champions again, but we have found champions within government who have been the best kind of partners you could wish for. I know people like to talk about Nigerian government and say, they're not doing anything, those people, this and that. But honestly, there are such amazing people working within government systems all over this country. And we have been blessed to interact with them, partner with them, and work directly with them. And yes, there are people who come with their own agendas. There's the corruption factor, there are all of those things. But we have been blessed to actually find people who want to make a difference, who want to see the work succeed, who want to work with us to meet our mutual goals because we're all working towards improvement of healthcare at the end of the day. Um, and so that has been a huge factor for us as well. That helped overcome the fact that, yes, I'm a woman, I may look younger than I am, and all those other things. So it's not been easy, but it's we've been really, really blessed to be able to have those people help us champion the work and push for us, even when we're not in the room, even when we've not written a letter. Um, but like you said, the environment is complex. Nigeria is complex, and other challenges, definitely the talent thing you spoke about is hard. We have suffered a major, major brain drain, as we all know, in the last few years, especially in the health sector. Our professionals generally have gone, our teachers, our bankers, our lawyers, many of them have left the country, but the health sector is not exempt. We've lost so many health workers, so many people in the public health space, which is where we operate. So it's hard because the talent pool is smaller. Um, and also, in the time we've been running the organization, when we started, the naira was 150 to a dollar. It's basically 10 times that now, 1,500, 1,400. So when you look at that pressure as well, the fundraising that is required for us to do what we need to do has had to be constant and always ramped up. But also compensation for team members has to be adequate. People have to be able to live comfortably and support their families. And so, again, talent retention and things like that become a challenge when you're dealing with limited budgets and an environment where inflation is outperforming interest rates and on investments and things like that. So it's not been easy, dealing with talent. But like I said, we have been so blessed from day one to have amazing team members. Um, and I mean, we don't have time now, but if I tell you the story of how some of the people who worked at DRASA and still work at DRASA came to DRASA, it's really just amazing. Truly, God has blessed us with talented people who have the passion and capacity to help us deliver on our mission. And I think other challenges are things like, dealing with different vendors and quality of certain things that we need for the work that we do. And also burnout because the work is hard and it's a lot. And we have been a small team, growing organically for many years. And so in the beginning, we were all doing many things. I was fundraiser, accountant, manager, leader, everybody was doing 20 things at once, as you normally see with entrepreneurs and startups. And so needing to be intentional about prioritizing staff well-being, my own personal well-being as the leader, pacing ourselves. Those are things that have been challenging because at times the work is urgent and important, and you just want to pour yourself into it, not realizing that you will soon run out of steam. So I think those are some of the challenges we faced.
Thank you so much for sharing that. Time will not allow me to ask of these and of that and of these and of that as a follow up to that. But just to the point you're making around, how you've attracted people, I would have loved to double click on that, but yeah, we don't really have the time. And I want to appreciate the fact that you've given me 1 hour, and I want to try and stick to that. One final question, maybe two final questions, right? I will ask them together, and and we can just wrap up, right? No, it's not. One is a question. One is more like a final word from you. So the question, Niniola, is if you have to do all this all over again, if you have to start it all over again, right? What would you do differently? Now you've had a good run, right? Nobody can take anything from your flowers. You've earned them and all of that. But looking back, are there 1, 2, 3 things that you just feel like if I have to start afresh, I will tweak this, I will tweak this, I will do this different things that will help us arrive even faster than we've arrived, right? One. And then your final thought to people who are out there who probably are hoping and praying and trusting that someday they'll be able to start what you started, right? What is like your final word, your encouragement to them, right?
Okay, great.
And that would be beautiful.
Thank you for those two questions. I think it's interesting, especially as we turned 10 last year. I did a lot of reflection over our journey to this point, and this question you just asked of, what would I do differently, came up in my mind. And there are a couple of things that I think I would be more intentional about and that I would do sooner. One definitely would be prioritizing a diversified funding structure from the beginning. Like I said in the very beginning, we were mostly funded by individuals. And just like with everything else, after a while, people move on. The story no longer resonates with them. They still know the name, they remember what she did, but financial support is not there. And so we had to, as that was waning and coming down, we had to quickly start looking for other sources of funding, and that has been sort of the rat race since then. So I think for us, one thing that I would have done differently is from day one, be very, very deliberate about having a diversified funding base. Local philanthropy, individuals, international philanthropy, corporate partnerships, long-term sustainable financing like this endowment and other approaches, making sure that everything is mixed so that the day that someone announces they're not funding anymore or this one is shutting down, we can still continue. And we're not dependent on external or we're not overly exposed to external factors. So that would be one thing. I think another thing is I would invest in our communications earlier on. In the first few years, we didn't have a communications person. We were so busy trying to fill technical roles and do the work that we were not telling our story. And we do such great work and we have done such great work, but without clear messaging and clear engagement, both social media, traditional media, and all other forms of communication, it's almost like the work is invisible. And so being able to tell our story, tell why what we do matters, what makes us different, what success looks like for us, having those things from the very, very beginning, I think is something I would do differently. We ended up investing a lot in it later, but it's something that we should have really started from day one. To make sure that we're visible, because a lot of times people say, oh, I know what she did, but I didn't know there was any organization in her memory. And so that helped us to realize that, whoa, we have a gap in our operations. We need to make sure that we're telling our story better. um, I would also, we did this somewhat, but I would strengthen even more our operational systems. Again, we invested a lot in the technical capacities, making sure we had people who were PhDs, doctors, nurses, veterinarians on the team, people who have the technical knowledge to do the work that we do. Um, and we did that in the early days without investing in HR. So again, we didn't have a comms person, we didn't have an HR person in the early days. So making sure that those structures were there from day one is something I would do differently. Um, and I think those are the main things I would say. If I was to speak to someone who wanted to embark on this journey now and start, there are two things I would say. The first is be very, very clear on your purpose and your why. If you're a person of faith, pray to God, be directed, be led, um, because it's going to be a hard journey. Let me not sugarcoat it, right? And the way you overcome the challenges is when you know that you can already see the end because you've been told that this is what you're supposed to do. So make sure that you're clear on your purpose, number one. And whatever that purpose is, don't deviate. It will be tempting. Someone will come to you and say, I have funding for this youth development project, and you're supposed to be focused on child health. Or, well, that's even close. Maybe you're supposed to be focused on something completely different. And they say, oh, no, come and do this work. There's money here. And then you go and do it. Then another person will come and say, oh, we're funding climate change. Now you're a climate change expert. Tomorrow you're doing this. Tomorrow you're doing that. It is very tempting. But just as much as you're going to get people saying no to you, you have to practice being able to say no to other people, because there will be times when it will take you away from your mission. It will take you away from your purpose. and you don't want to miss whatever it is that you're supposed to be doing because you're distracted with something else. So stay focused, know your mission, and then stay focused on it. And then the second thing I would say is protect your personal health. When you're passionate and when you're really committed to something, it can be easy to sacrifice. It can be easy to work late nights, work weekends. I did all of those things in the early days. Before I had a family, it was okay. But once I had a family, it became a challenge because now there's sacrifices involved. So find a balance and put things in place to prevent burnout, to make sure that you can show up for the people that matter to you in your life beyond the work, because the work will always be there and tomorrow's another day. So those would be the pieces of advice that I give.
I'll drink to those. I'll drink to those. Thank you so much for not just sharing, right, but sharing from your heart, right? Because I have a feeling those came
Yeah.
from very deep places, right? And thanks for pulling them out. It's been an absolute delight talking to you this afternoon, just hearing your story, right? And for all that you've shared, thank you so much. Hey, thanks a lot for taking the time to watch the podcast. We are super thankful for you taking that time and investing the time to learn. We hope that you find the story inspiring, and beyond that, that you've been able to articulate one or two things that you want to do differently in your own entrepreneurial journey. May I encourage you to please like, subscribe, comment, and please share the word within your own circle of influence, especially within those that you think are on the same entrepreneurial journey with you. May I also encourage you to please, beyond subscribing to our YouTube channel, follow us on our other social media platforms. That means a lot to us, and we can see that that helps us to track that we're making some progress and so making some impact. Thanks a lot once again for taking the time to watch, and we'll see you on the next episode.